The Detroit riverfront hummed with a quiet energy on that mild Saturday, April 20th, 2025. Families strolled along the paved paths, cyclists glided past, and the Detroit River shimmered under a gentle spring sun. New apartment buildings and trendy cafes stood as testaments to a city reclaiming its narrative, a story of comeback and renewal. The gleam of fresh paint and modern glass reflected a hopeful future. Yet beneath this polished surface, a different story unfolds daily, one that is often unseen by those admiring the city's revitalized skyline. This is the story of Detroit's hidden crisis, the pervasive issue of homelessness that challenges the very definition of the city's progress and prosperity for all its citizens. This counter-narrative of homelessness runs parallel to the headlines of Detroit's economic revival. While new stadiums rise and historic buildings are meticulously restored, thousands of residents navigate the precarious reality of having no stable place to call home. The city's glossy revitalization campaigns often overshadow the harsh experiences of its most vulnerable population. This disparity highlights a critical question: who truly benefits from this resurgence? For many, the bright lights of downtown cast long, dark shadows where individuals and families struggle silently for basic shelter and dignity. Addressing this is not merely a social issue, it is a fundamental aspect of the city's true health. Recent statistics paint a stark, if incomplete, picture of this challenge. A federally mandated count in early 2024 recorded 1,725 people experiencing homelessness across Detroit, Hamtramck, and Highland Park. Among them, 1,420 were in some form of shelter, but a significant 305 individuals were unsheltered, living on the streets, in cars, or in abandoned buildings. These point-in-time counts, while essential, are widely acknowledged to be underestimations. They offer a snapshot, but the true number of people cycling in and out of homelessness is likely far greater. The number of unsheltered individuals, in fact, doubled from 151 in 2015 to 305 in 2024, signaling a worsening situation for those on the very edge. In response to this growing crisis, significant funding efforts and strategic plans have emerged. In early 2025, Detroit's Continuum of Care, the lead agency coordinating homeless services, secured a substantial $40 million award from the U.S. Department of Housing and Urban Development. This funding is earmarked to bolster emergency beds, expand rapid rehousing vouchers, and develop more supportive apartments. Additionally, the Detroit City Council redirected $5 million of American Rescue Plan funds for homelessness services for 2025 to 2026, and the mayor's office committed an additional $2.4 million for outreach and prevention. These financial injections are crucial components of the Homeless Action Network of Detroit's ambitious 2024 to 2028 strategic plan, which aims to transform the system. The root causes of homelessness in Detroit are complex and deeply embedded in the city's economic and social fabric. A primary driver is sheer economic disparity. The median household income in Detroit hovers just under $40,000 a year. This figure starkly contrasts with the incomes in many surrounding suburban communities, often double or more. Compounding this, asking rents in the city have surged by approximately 1/5 since 2020. A modest two-bedroom apartment in a gentrifying neighborhood like Corktown can easily command $1,200 per month. Michigan's minimum wage, currently $10.10 an hour, means a full-time worker earns just over $1,700 a month before taxes, making such rents an enormous burden, if not entirely out of reach. Beyond immediate economics, structural issues have long contributed to housing instability. Decades of factory closures dismantled the city's once robust industrial base, leaving a labor market that never fully recovered, especially after the 2008 financial crash. The legacy of redlining, discriminatory practices that denied mortgages and investment in predominantly black neighborhoods continues to cast a long shadow. These districts still suffer from chronic underinvestment, poorer infrastructure, and under-resourced schools. Now, as parts of the city gentrify, areas like Midtown and Brush Park are seeing property taxes spike by double digits, putting immense pressure on long-term residents and low-income homeowners, often forcing them to sell or abandon their properties. Systemic issues within the population facing homelessness further complicate the situation. Within Detroit's shelter system, nearly 1 in 3 adults grapples with a serious mental health diagnosis, a challenge often exacerbated by the trauma of homelessness itself. Approximately 1 in 5 adults in these shelters faces substance use challenges, requiring specialized support and treatment. Furthermore, an estimated 1 out of every 4 women in shelters are survivors of domestic violence, seeking refuge from abusive situations. With childhood poverty rates hovering near a staggering 30%, the cycle of instability often begins early, creating generational barriers to housing security and overall well-being for many young Detroiters. Access to fundamental resources also remains a significant hurdle for many Detroit residents. 1 in 5 Detroit families lives in what are termed grocery deserts, areas lacking convenient access to full-service supermarkets offering fresh, healthy food options. Similarly, many corridors throughout the city lack comprehensive health clinics, making preventative care and treatment for chronic conditions difficult to obtain. Recent efforts to improve housing quality through new rental regulations have inadvertently increased compliance costs for landlords. While well-intentioned, this has, in some cases, contributed to higher rents. With only an estimated 8% of landlords currently in full compliance, many residents find themselves paying more for subpar housing, further straining their already tight budgets. The impact of homelessness on individual health is profound and costly. People without stable shelter are twice as likely to be diagnosed with chronic conditions such as hypertension, diabetes, or HIV. The constant stress and exposure associated with homelessness make managing these conditions incredibly difficult. In 2023 alone, unhoused residents in Detroit made an estimated 14,000 emergency room visits. These visits generated approximately $17 million in uncompensated care, as the average ER visit costs around $1,200. This financial burden is largely absorbed by hospitals and indirectly by taxpayers, highlighting the hidden public costs of not adequately addressing the crisis through preventative housing measures. Children are particularly vulnerable to the devastating effects of homelessness, with long-term consequences for their education and development. During the 2023 to 2024 school year, Detroit Public Schools Community District served over 3,200 students identified as homeless. This represents nearly 8% of the district's total enrollment. These students missed, on average, 18 school days annually, significantly impacting their learning and social development. The tragic deaths of 2-year-old Amila Curry and 9-year-old Darnell Curry Jr. in February 2025 from carbon monoxide poisoning in their family's van served as a horrifying reminder of the system's failures. Their mother had reportedly sought assistance months earlier, but was not prioritized for immediate shelter, tragically unaware of nearby emergency options. Despite the daunting scale of the problem, grassroots initiatives and community-driven efforts are providing crucial support and fostering hope. The Coalition on Temporary Shelter, COTS, is one such organization, actively working to break cycles of poverty by connecting families leaving emergency shelters with dedicated career coaches. These coaches guide them into union apprenticeship programs in fields like plumbing, electrical, and carpentry, offering pathways to stable, well-paying careers. Another beacon is Mariners Inn, a recovery center that has deployed mobile medication-assisted treatment, MAT, vans. These vans patrol areas with high concentrations of unhoused individuals, providing naloxone, harm reduction supplies, and vital treatment, contributing to a 14% drop in overdose fatalities in their service area within 12 months. Anti-Nays Village offers another inspiring example of community resilience and innovation. This initiative transformed a dilapidated duplex into a vibrant micro-campus. It features a free weekend produce stand addressing food insecurity, a STEM lab providing educational opportunities for local children, and even prototype tiny homes equipped with solar panels and rainwater harvesting systems, showcasing sustainable housing solutions. Alongside these grassroots efforts, corporate contributions have also begun to flow. In early 2024, Ford Motor Company committed $5 million to a new Housing Stability Innovation Fund. The Rocket Community Fund earmarked $2 million for eviction prevention legal aid, and TechTown, a local tech incubator, donated $250,000 to launch a digital safety net for telehealth and online job resources. Addressing homelessness is not just a moral imperative, it is also an economically sound strategy. A 2023 University of Michigan analysis starkly illustrated this point. The annual public cost for an individual cycling through emergency rooms, county jails, and temporary shelter beds is approximately $39,500. In contrast, the annual expense of providing permanent supportive housing, which includes wraparound services like case management and healthcare access, is nearly half that, at roughly $20,500 per year. Furthermore, studies indicate that every dollar invested in Housing First programs, which prioritize getting people into stable housing quickly, returns an estimated $1.60 in savings on healthcare, justice system expenses, and other social services over a 5-year period. However, the path to providing adequate services is fraught with challenges. The current system is significantly under-resourced in terms of personnel. Detroit's continuum of care employs 60 full-time case managers to assist the over 1,700 individuals experiencing homelessness on any given night. This creates a case manager-to-client ratio of nearly 1 to 28, far from the ideal ratio, which is closer to 1 to 10, needed for effective support. Consequently, individuals and families seeking help often face long delays. An alarming 82% of calls to the Coordinated Assessment Model, CAM Detroit, the central intake system, result in placement on a shelter waitlist. Families can wait an average of 130 days for shelter, a period of profound uncertainty and hardship. A fundamental issue is the chronic shortage of affordable and supportive housing units. In 2023, Detroit managed to add about 1,500 subsidized apartments to its inventory. While this is a positive development, it falls far short of the estimated 5,000 additional units needed to make a significant impact on chronic homelessness in the city. The Homeless Action Network of Detroit's strategic plan aims to address this gap by delivering 870 new permanent supportive housing units by 2027. This is a crucial target, leveraging the recent HUD funding, but sustained efforts and innovative solutions will be required to meet the full scale of the demand. The urgency is heightened by the use it or lose it deadlines attached to much of the federal stimulus funding, demanding swift and efficient implementation. Ultimately, the city's approach to homelessness must be grounded in the principle that shelter is a fundamental human right, not a commodity or a privilege. The overall health and prosperity of Detroit are inextricably linked to the well-being of all its residents, including those without a place to call home. Overcoming this crisis requires sustained political will, transparent data to guide decision-making and track progress, and an unwavering commitment to long-term systemic solutions rather than temporary fixes. The recent infusion of funds and strategic initiatives are promising steps, but the journey to ensure every Detroiter has a safe, stable, and dignified place to live is a marathon, not a sprint, demanding continuous effort and community-wide dedication.